The most common primary immunodeficiency in children is severe combined immunodeficiency, IgA deficiency, chronic inflammatory disease, none of the above. Correct answer is option B, IgA deficiency. A newborn with persistent jaundice beyond 2 weeks should be evaluated for physiologic jaundice, breastfeeding jaundice, biliary atresia, phototherapy overdose. Correct answer is option C, biliary atresia. A child with measles should be isolated for 3 days, 7 days until cough stops, 4 days after rash appears. Correct answer is option D, 4 days after rash appears. Which vaccine prevents epiglottitis in children? DPT, HIV vaccine, MMR vaccine, influenza vaccine. Correct answer is option B, HIV vaccine. Which organ is primarily affected in Wilms tumor? Liver, lung, kidney, brain. Correct answer is option C, kidney. The earliest sign of puberty in boys is usually increase in testicular size, voice change, growth spurt, appearance of facial hair. Correct answer is option A, increase in testicular size. Which condition causes proglyph posture in newborns? Spina bifida, neonatal sepsis, cerebral palsy, developmental dysplasia of hip. Correct answer is option D, developmental dysplasia of hip. Which reflex disappear last in infants? Moral reflex, Palmar grasp, parachute reflex, rooting reflex. Correct answer is option C, parachute reflex. The commonest cause of secondary hypertension in children is renal parenchymal disease, essential hypertension, endocrine disorders, none of the above. Correct answer is option A, renal parenchymal disease. The cat's cry syndrome is caused by deletion of chromosome 18, chromosome 15q, chromosome 21, chromosome 5p. Correct answer is option D, chromosome 5p. Which of the following is a sign of severe dehydration in a child? Tearful crying, slow capillary refill, moist mouth, normal skin turgor. Correct answer is option B, slow capillary refill. The most common cause of wheezing in infants is bronchiolitis, asthma, foreign body aspiration, cough. Correct answer is option A, bronchiolitis. Which drug is used to close a patent ductus arteriosus? Prostaglandin E1, endomethacin, dopamine, furosemide. Correct answer is option B, endomethacin. When a 1-year-old does not sit or stand, the nurse should suspect normal variation, motor developmental delay, cognitive delay, hearing impairment. Correct answer is option B, motor developmental delay. A child presents with fever, sore throat and drooling while sitting in a tripod position. The most likely diagnosis is epiglottitis, cough, laryngomalacia, foreign body aspiration. Correct answer is option A, epiglottitis. Which vaccine is given orally? OPV, BCG, DPT, MMR. Correct answer is option A, OPV. While assessing a toddler, the nurse notes a sunset sign in the eyes. This is indicative of hydrocephalus, meningitis, retinoblastoma, cerebral palsy. Correct answer is option A, hydrocephalus. Which sign indicates effective phototherapy in a neonate with jaundice? Failed stools, decrease in serum bilirubin level, decrease urine output, bluish skin tone. Correct answer is option B, decrease in serum bilirubin level. Which sign is most characteristic of scabies? Vesicular rash on the trunk, itchy rash between fingers and wrist, blister on lips, patchy hair loss. Correct answer is option B, itchy rash between fingers and wrist. A nurse is teaching parents about febrile seizures. She should include anti-epileptics are always needed. Seizures usually cause brain damage. Febrile seizures are self-limiting. They always indicate epilepsy. Correct answer is option C. Febrile seizures are self-limiting. While administering oral iron drops to a 3-year-old, the nurse knows the best way to prevent teeth staining is give with milk, use a straw or roper, mix in fruit juice, brush immediately after. Correct answer is option B, use a straw or roper. The danger sign in a child with diarrhea includes increased appetite, fasting more than 4 stools a day, sunken eyes, slight fever. Correct answer is option C, sunken eyes. Which cardiac defect is most strongly associated with Down syndrome? Tetralogy of Fallot, atrial septal defect, complete atrioventricular septal defect, none of the above. Correct answer is option C, complete atrioventricular septal defect. The recommended position for an infant during sleep to reduce SIDS risk is prone, supine, side-lying, semi-prone. Correct answer is option B, supine. A 7-year-old with cystic fibrosis is admitted for a pulmonary exacerbation. The most important nursing intervention before meals is administer pancreatic enzymes, encourage water intake, offer high fiber snacks, provide supplemental oxygen. Correct answer is option A, administer pancreatic enzymes. In newborns, delayed cord separation beyond 3 weeks is most commonly associated with severe combined immunodeficiency, leukocyte adhesion deficiency, cystic fibrosis, none of the above. Correct answer is option B, leukocyte adhesion deficiency. A 4-year-old says, I got sick because I was bad. The nurse understands this as magical thinking common at this age, a sign of anxiety disorder, cognitive delay, regression. Correct answer is option A, magical thinking common at this age. The most common cause of chronic cough in children under 5 years is tuberculosis, bronchial asthma, bronchiectasis, foreign body aspiration. Correct answer is option B, bronchial asthma. The most common cause of diarrhea in infants worldwide is rotavirus infection, E. coli infection, salmonella infection, none of these. Correct answer is option A, rotavirus infection. The term failure to thrive refers to preterm baby, inability to grow adequately, hypoglycemia, premature puberty. Correct answer is option B, inability to grow adequately. The most reliable way to confirm adequate oxygenation in a child is skin color observation, pulse oximetry reading, heart rate measurement, respiratory rate counting. Correct answer is option B, pulse oximetry reading. A newborn's heart rate is 90 beats per minute and he is pink with strong cry. The nurse should begin chest compressions, provide oxygen, call the physician urgently, continue routine observation. Correct answer is option D, continue routine observation. Which condition shows ground glass appearance on X-ray in newborns? Neonatal pneumonia, hyaline membrane disease, meconium aspiration syndrome, bronchopulmonary dysplasia. Correct answer is option B, hyaline membrane disease. Which of the following is used to diagnose cystic fibrosis? Chest X-ray, urine culture, sweat chloride test, none of these. Correct answer is option C, sweat chloride test. The most common cause of microcephaly in newborns is genetic disorders, intrauterine infections, maternal malnutrition, birth asphyxia. Correct answer is option B, intrauterine infections. The most frequent cause of nephrotic syndrome in children is minimal change disease, post-streptococcal gene, membranous nephropathy, none of the above. Correct answer is option A, minimal change disease. Which growth parameter best reflects chronic malnutrition? Weight for age, height for age, mid-arm circumference, head circumference. Correct answer is option B, height for age. When assessing a 6-month-old, the nurse expects which developmental skill? Fulls to stand, sits without support, rolls over both ways, says simple words. Correct answer is option C, rolls over both ways. A newborn's stool is thick, greenish black. The nurse identifies it as transitional stool, meconium, breast milk stool, mucus stool. Correct answer is option B, meconium. When using a metered dose inhaler for asthma, the nurse should be advised to exhale immediately after inhalation, hold breath for a few seconds after inhaling, take the medication after meals, avoid rinsing mouth afterward. Correct answer is option B, hold breath for a few seconds after inhaling. While performing heel flick for newborn screening, the nurse must warm the heel before puncture, use alcohol swab and puncture center, apply strong pressure after, avoid wiping first drop of blood. Correct answer is option A, warm the heel before puncture. The drug of choice for febrile seizures in children is diazepam, phenobarbital, lorazepam, midazolam. Correct answer is option A, diazepam. The most common cause of hematuria in children is IgA nephropathy, nephrotic syndrome, trauma, urinary tract infection. Correct answer is option D, urinary tract infection. The best way to prevent diaper rash is frequent diaper changes, applying talcum powder, restricting fluids, using tight diapers. Correct answer is option A, frequent diaper changes. When teaching toothbrushing to a 5-year-old, the nurse should advise: let the child choose when to brush, brush once a day, use fluoride toothpaste and supervise brushing, avoid toothpaste. Correct answer is option C, use fluoride toothpaste and supervise brushing. When caring for a dying child, the nurse's most important role is to focus on pain relief and family support, avoid discussing death, emphasize medication schedules, limit family visits. Correct answer is option A, focus on pain relief and family support. The most common cause of death in children under 5 worldwide is malaria, diarrheal disease, tuberculosis, pneumonia. Correct answer is option D, pneumonia. A nurse is assessing a newborn who sneezes frequently but has no fever or cough. This most likely indicates neonatal cold, normal nasal irritation from amniotic fluid, drug withdrawal, early infection. Correct answer is option B, normal nasal irritation from amniotic fluid. A nurse giving DPT vaccine to an infant observes swelling and redness at the site. The next best action is apply warm compress and observe, re-administer the dose, give another vaccine immediately, call emergency team. Correct answer is option A, apply warm compress and observe. The best indicator of adequate nutrition in an infant is steady weight gain, daily crying, sleeping long hours, increased appetite. Correct answer is option A, steady weight gain. The most common cause of iron deficiency anemia in toddlers is thalassemia minor, low dietary intake, chronic kidney disease, none of these. Correct answer is option B, low dietary intake. Koplik spots are pathognomonic for rubella, measles, mumps, varicella. Correct answer is option B, measles. Thanks for watching. Subscribe to the channel for the latest informative MCQs.